I'm really excited to host this next discussion, which is close to my heart as someone who's personally experienced pregnancy loss. I'm joined by hundreds of thousands of women and families across the country who also share in this experience. Yet when it comes to support for parents and families going through fertility issues, there's often a lack of support and a sense of reluctance to talk, particularly in workplaces. It's good to see some movement from governments and organisations to make changes here, but there's still considerable work to be done. So how can employers be active in their support of women and families navigating fertility challenges or loss, from egg freezing to IVF to support through miscarriage and stillbirth? For this session of fertility support, I'm joined by two special guests, Samantha Payne and Dr. Nisha. Sam Payne is the co-founder and CEO of the Pink Elephant Support Network. After experiencing her own pregnancy losses, Sam identified a gap in terms of emotional support for couples experiencing early pregnancy loss and fertility challenges. And Dr. Nisha Khot is an obstetrician at the Royal Women's Hospital and Western Health. She is also a board director of the Royal Australian New Zealand College of Obstetricians and Gynecologists, RANZOG. So thank you so much to both of you for joining me today, and also for bearing with us as the sessions have taken a little bit of time, but although we seem to be on a relatively good schedule now. Look, I want to open up the conversation around, I guess the commonality of fertility challenges that women and families experience. And, we know that this is a trauma that so many do go through, whether that be struggles with IUI or IVF, or even experiencing the trauma of miscarriage or stillbirth. Yet they are still topics that are rarely spoken about at work. And there's still an expectation for women and families to get on with things or keep it under wraps. What needs to be done to shift that taboo, Sam?
We need to change the narrative so that people understand the true impact of all of these struggles. So pregnancy loss, fertility challenges, they're not a moment in time. For many women, they induce intense emotional distress, which if left unsupported can last for months, if not years. So we need to get a better understanding out, some more general awareness that actually these parts of journeys of trying to have a child can truly impact you for a long time. And it isn't a moment in time that a week later you can minimize with, well, at least it happened early, or at least you can fall pregnant. And all of those things together create this perfect storm, which then creates silence. The silence is deafening. What that says to the person who's going through it is that your experience doesn't matter, your loss doesn't matter. You need to just get over it. And actually what we found through research is that's not true at all, and that what we're actually doing is we're isolating and we're actually contributing to poor mental health outcomes. So yeah, for us, we think it's around awareness, sharing the true stories and the true impact of these challenges.
Yeah. And you've done considerable work in this space and had some big wins in recent times, Sam. Can you talk us through a little bit about some of the motions that you've helped to push through so far?
Yeah, sure. This year has been a really big year for us. We're really proud that our Leave for Loss campaign, that we lobbied federal government for 3 years to seek an amendment to the Compassionate/Bereavement Leave Act, to entitle anybody who has a miscarriage or a pregnancy loss prior to 20 weeks to paid compassionate leave. It was really important to us that we got that through. It wasn't about the amount of leave, it was about the validation that pregnancy loss goes hand in hand with bereavement, and we need to validate it as grief, and that starts a healthier process of being able to work through that trauma and not feel isolated and alone in it. So yeah, we had a huge win there. I think it was September this year that actually passed. It still feels very surreal because it happened like this. It was virtual because of the year, right? But it's in real life. Just last night, I was in our online communities, and there were women in the miscarriage group talking about how their workplace had offered 5 days to them now because of this legislation change. So we're seeing workplaces step up and offer more than the amount that we've got through. So yeah, really proud of our work that we've done there.
Yeah, it's brilliant, and it's great to hear that that impact is already being felt, and that women are already, really experiencing the positive changes of that coming into effect. Dr. Khot, I want to ask you a similar question around, how do we get to a place where we are having easier conversations about these topics in all kind of corners of our life?
Yes, I think, Tarla, it's a testament to how we approach things, isn't it? That women have been in the workplace now for how many ever years, and we still very rarely talk about things that affect women specifically, like pregnancy loss, like periods, like menopause. There are so many issues that become these silent things that nobody ever talks about. And part of kind of moving away from that is to make it a normal conversation. Health is something that we bring with us to work. Nobody can come to work if they are not feeling as healthy as they want to be. And if that is something that is playing at the back of your mind, that is affecting your productivity at work. And so from a very simple perspective of, as an employer, wanting your employees to give their 100% to work, the best way you can ensure that they give 100% to work is to make sure that they are 100% healthy and feel like they have a workplace that promotes that health for them. And so making that the norm from a human perspective, yes, but if we think about it purely from an economic perspective, as an employer, you might want to look at it like that. But even from that economic perspective, it makes sense for us to have those conversations and to make sure that we provide the support that means that every woman who comes to work can give 100% when she's there.
Yeah, absolutely. Sam, I want to talk to you just quickly about, we know that we need to normalize these conversations. We know that we need to lift the taboo. But I think part of it also falls into this space of feeling very uneasy and grief-stricken and sad for people that are experiencing this kind of trauma and not knowing how to navigate that. So do you have any kind of tips there for, how we actually have these conversations and some of the language that we should use?
Yeah, absolutely. I touched on it a little bit earlier around minimizing. So firstly, we'll start with what not to say. So never start a sentence with someone who's gone through loss or going through at least, because all you're doing is kind of minimizing their experience, and you're telling them that it doesn't matter and they don't need support, and that's not the truth. And we know that those are the most hurtful comments that we often still hear every day. Again, they're shared in our online communities. What we want to get better at is having really difficult conversations. They're not easy conversations, but it doesn't matter. You shouldn't be scared to have these conversations, because we have to start somewhere to normalize, to Nisha's point earlier around that if we're going to get better at talking about these topics so that people are better supported, then that starts by having hard conversations. So not being scared to have a conversation, thinking about how you validate their experience. So however they perceive their experience is how you need to validate it. Offering empathy. So that's not sympathy. Empathy is very different. It's about sitting with them, not trying to fix them. Not saying, oh, well, my auntie had this treatment and she went to this acupuncturist here. And have you thought about doing this? And have you taken these herbal supplements? And because we want to fix pain, that's kind of natural for us, but we can't fix the pain. That's not your role as a support person. It really is just to sit with them through the dark times and acknowledge that these are really hard and difficult times, and I can sit with you.
Yeah. And Dr. Khot, do you have anything to add on to that?
I suppose different people react to grief differently. And I think one of the things that often we don't do is ask for permission. Just ask for permission. Is it all right if we sit down and have a chat? And what would you want me to do for you? That would help. Ask the person, and the person will be able to tell you what helps them, because we're not all the same. If I feel I don't want to talk about it and somebody is, actively wanting to talk about it, that's the wrong thing for me. Whereas for someone else, it might be actually wanting to talk about it. So I think start from a place of asking for permission and, asking what you can do to help. It's a very simple question. We do that all the time in all sorts of other situations. We can apply the same principles here.
Yeah.
Keep trying. You might not want to respond straight away. That's okay, because you've got different stages of grief. Keep trying and trying different ways. And don't be afraid if they don't want to speak, they're not ready. But That's a perfectly normal response.
Yeah. Sam, we spoke a little bit about your achievements this year and some of the legislation that has passed through, including miscarriage and bereavement paid leave. What more should we expect from policymakers to better support women in their fertility?
Yeah, absolutely. For us, it's not just about policy. We need to see action around these subjects now. So we need to see more cross-sector collaboration. We need to see peak bodies like Ransgog come together with consumer organisations such as Pink Elephants, researchers such as Miscarriage Australia, to truly understand the problem, to then build out support services that work, establish clear referral pathways. We know that majority of women still turn to Google to try and find support for issues like these. And whilst there might be reputable information, you're actually at risk of finding all sorts of things on there, as we know. And look, everyone Googles. We're not going to tell people not to Google. I Google, right? But we can also make sure that health professionals who are trusted and credible are giving trusted evidence-based referral pathways. We're going a huge way to kind of the antidote to that as well. So yeah, we want to see a national action plan, and we want to see more cross-sector collaboration specific to, for us, it's miscarriage and early pregnancy loss. So loss prior to 20 weeks. We just feel that there is such a gap there. And there are some state policies, but there's no federal guidelines for the treatment. If you break your arm, there are guidelines. If you have cancer treatment, there are clinical guidelines. There is nothing for miscarriage. To Nisha's point earlier, it's a women's problem, so nobody's dealt with it. We've just left it off the table or brushed it under the carpet, as we say, for far too long now. And we believe that women and their partners deserve so much more. So yeah, there's a lot still to be done, and you'll hear a lot more next year on this too.
I don't doubt it for a second. Dr. Khot, is that something that you agree with?
Absolutely. I think that is very important to have a national, we've done it with endometriosis, so we can do it for women's health issues, and it's high time we did it for so many of the issues that have so far just been swept aside, put away. It's time to address all of them because they affect, yes, 50% of the population, because, more than 50% are women, but that also means that they affect the other 50% because there is the other half of the population that is equally affected by those conditions. May not be directly, but indirectly they are affected. And so, yes, it's time to address them.
I think that's a really interesting point you've just raised, actually, because so often when we speak about fertility, we do kind of place that pressure and the problem with women when we know that 50% of fertility challenges are coming from men. So how do we bring men more into this discussion as well, and to make that a normal conversation for them to have? Because I think it's pretty challenging from that regard as well.
It's like we forgot it takes two to have a baby, right? It's like a problem because women, their sole purpose is just to have babies, right? We've kind of been fed this narrative, this fairy tale for too long that like the partner's role has been forgotten. And then to add to that, what we see from pregnancy loss is that the impact on the partner is actually the same. There's research from Kate Obbs, the University of Adelaide, done excellent research into how partners grieve, and partners need exactly the same type of support, and that's not happening at the moment. So I think, again, it starts with awareness. It starts with sharing the truth of these experiences, normalizing, having these conversations in platforms like this. In workplaces too is really powerful because a lot of male-dominated organizations, as Nisha said earlier, work's set up for men still, right? So let's start there in a way, because sometimes that's where you get more buy-in still, sadly. But,
and the interesting thing is that although workplaces are set up for men, they're actually not set up to support men when they go through struggles either. So, although we are talking about women's health at work, I don't think workplaces do very well with men's health at work. So it should be about everybody's health at work, because we all have similar needs. They might be in different spaces, but we have similar needs.
Yeah, exactly. So we have seen some employers, especially in recent times, gravitate to the idea of providing free services or support in certain services like egg freezing for their employees. What are your thoughts about this, Dr. Khot? And do you feel that that's a positive move? Should we look to see how employers can better subsidise more fertility treatments and options? Is this a real way of supporting the workforce?
So I think when we talk about egg freezing, often it comes with this sort of attitude of, oh, it's women who are putting their careers first, and they can't be bothered having children right now. And first of all, I think it's really important to shift away from that. It's just life circumstances. It doesn't mean that women are putting one thing above another or anything like that. And the whole point of egg freezing is to avoid future childlessness. And that applies to anyone and everyone. And so I think the way employers are trying to support not just women, but couples in their fertility kind of journey by trying to subsidize various things, and egg freezing is one of them, is a good move. It's a positive move. It won't be what everybody wants. Of course it won't, but there will be a proportion for whom this will be beneficial. And I think certainly we should continue to support whatever it is that our as employees want in that situation. And I think moving away from that stigma of kind of, oh, if you want to freeze your egg, you must be one of those type A women who wants to get to the top position and doesn't want to have children. I think that makes a huge difference. And research shows that that's not the group of women who want to have their eggs frozen at all.
Yeah. Sam, do you have anything to add on to that one?
No, I just echo everything that you've just said. Let's remove the stigma. Let's stop judging people for personal decisions. Let's make treatments accessible, equitable. Having these conversations in workplace is a sensible thing. It's not it should happen. It's 2021, not 1951 is probably what I want to say there. Not sure it should, but I am. But yeah.
I don't know. I mean, sometimes I think this government does think that it's 1951, so we might need a little bit of movement there. So what broader supports do you both feel need to be in place and easily accessible for all women and families who experience fertility issues or pregnancy loss?
So look, I think there needs to be so much more to be done. We've talked about the awareness raising, but then we actually have to provide support services that work, support services that are peer reviewed, that are evidence-based, that work in harmony with medical peak bodies as well. So Pink Elephants does this in a beautiful way. We have different programs for different audiences. We have to make sure that support programs support the whole journey and they're not just for the grief, because grief is intense often in those first few weeks. But then you have to consider journeys like trying to conceive again after loss, or fertility challenges going through IUI, IVF. They shouldn't be walked alone either. And then pregnancy after loss. We often forget, or we have an assumption that a woman falls pregnant and, okay, let's forget everything that happened. She's going to be totally grateful and super happy that she's pregnant right now, and everything's going to be magically better and it is all rainbows. And that's just not the case. What we find is that the majority of women spend those 9 months in a high state of anxiety, and they deserve to have support. So for us, it's about support. We want to see more support that's tailored specifically to needs. So it's almost like personalized healthcare as opposed to just generic. To Nisha's point, we all grieve differently, we react differently, we're all different human beings, and we should celebrate that. But we have to be more aware and appropriate the services so that they meet all these individual demands.
Nisha?
And just taking up Sam's point of the fact that, there is a whole aspect of mental health to all of this fertility, pregnancy loss, another pregnancy after a pregnancy loss. And what employers can do is support that mental health journey for all their employees. Most workplaces will have an employee assistance program, but it will only be limited to whatever it is, 6 or 10 or whatever sessions, it will have a limit on it. And I think it's important to recognize that mental health doesn't stop at 6 visits with a psychologist, that it is a lifelong journey. And to support that lifelong journey, supporting mental health of employees is something certainly that workplaces can and should do for all their employees. And again, not just mental health, but there's a whole host of other things that are also involved in health, whether they be things like physiotherapy, things like, hydrotherapy, whatever the situation might be for a particular employee. supporting access to those and subsidizing access to those, I think, is something that employers can certainly work towards making sure everybody can access.
Yeah.
I think, sorry, we've just done one thing that works really well to that point, Nisha, is that we've launched this year peer support companions within workplaces. So much like you have a mental health first aider, we now work with certain organisations like PwC and QBE, for example. And what they do is they take people who've got lived experience of these issues, they run them through a training programme with us, Pink Elephants, through our workplace setting. And what they do then is they become the go-to person in that organisation, because they can hold peer support for someone who's going through it. They can also support people leaders, because we're forgetting about that, right? Often people are at work, their people leader hasn't gone through this, and they're having these really awkward conversations. They're not empowered in how to meet them with empathy and understanding. So we train up people to work in that setting, and it's kind of a marrying of both worlds. And it works so far. What we've seen from piloting this year is that it works really well. So we'd love to see more of that and come across with the organisations that we work with, so that workplaces are better equipped. So policy is not enough. Let's actually equip our people to have these conversations properly too.
And Tarla, we are talking about pregnancy and fertility, but important to recognize some of the causes for problems with fertility. So things like endometriosis. We've seen a study recently that says women lose their jobs because they have endometriosis, and coping with the pain and the symptoms of endometriosis at work is really challenging. And so making sure that there are policies in place and workplaces that support women who are going through whatever that condition might be. Endometriosis is just one of them, but there are many others. At work is equally important, as important as piece of work to do with actual pregnancy and pregnancy loss is that journey to get to pregnancy.
Yeah, absolutely. I think it was 1 in 6 women in Australia have experienced either, being sacked or actually having their career impinged from their symptoms of endometriosis, which is just staggering in itself. And I think that's a really good point. I want to ask you both about some advice you might share for women and families that are going through this kind of turmoil, and how they can actually approach their employer and have those conversations as well. Because I guess that's often where some of this starts is an employer might not know what is actually going on. And too often we do see people trying to keep things under wraps, which, to Nisha's point earlier, sometimes that's a preference and, a psychological safeguard in some sense, but at other times it's not that at all. It's that they don't feel that they're going to have the conversation that they want or get the support that they need. So just what are some tips there for starting that conversation with employers?
I'm happy to jump in. I think with us, what we recommend through our workplace training is that you give your people leaders in your HR a heads up via probably email first that this is an issue you're going through. Send them a link to something like Pink Elephants so that then they can educate themselves. What you're trying to do is set up that conversation so it's at least going to be met with more empathy and understanding. If you just catch them as they're walking down the hall because you've built up the nerves and you just want to divulge it, you've got to be aware that sometimes then they're not going to react in the best way either. This can be a sensitive conversation, so try and set it up in the best way possible. Bear in mind that if it's something that you can't do yourself and you just don't feel like you can have those, then there are organisations like ours that will approach your HR department for you. We've done that many a time. We can do that on an anonymous basis to start with, so that we can start a conversation so that they understand they've got people in their organisation going through these issues. This is how you should be meeting them, and we can help in that way too. But just really consider how you're going to have that conversation, and if you can kind of provide a link to some kind of education for them ahead, you're more likely to be met with. And the other final point is that we did some research with the University of Sydney this year, and we found the overall, so we surveyed 700 women about returning to work after a pregnancy loss, and we found that the main reason women didn't share with their workplaces was actually because they were in male-dominated organisations that were quite unfriendly to any women's health issue at all, and they just couldn't find their voice around it. So I also think that it's not just about the woman or the partner finding a way to have these conversations. Workplaces have a role. They have to step up, acknowledge that these happen, and provide support programs to make sure that people are met in the right way.
And I will only add that know what you are entitled to and what your workplace rights are. Because once you know them, then if the conversation always starts in a good, positive place, but if that conversation doesn't go down the route that you would want it to go down, then it's really important that you are informed about what your rights and entitlements are, so that then you can actually, advocate for them.
Yeah, I think that's a really great point. We've actually got a session coming up later in the program today around your rights at work. So for anyone listening in now, you should check in on that session as well. Just one last question around, we spoke a little bit about how these issues are, so often, well, they are both parts of the equation, right? And we need to bring men into these topics and we need to normalize the conversation for them too. But how do medical providers in particular do that? Because, employers are only one part of the equation here. How do we get men to feel more comfortable there from a medical perspective and seeking that information and expert advice?
I think from a doctor's point of view, if I were to see somebody who was either having a fertility issue or, in early pregnancy with miscarriage, I would always see the couple as a couple. Because for me, it's not about seeing just the woman, it's about seeing both the partners, because from my point of view, they are both equally important and they both are equally deserving of my explanation, time, attention, care, whatever the case might be. And so I think starting from that point of actually seeing everybody as a couple, and COVID has made a huge impact on that, because we had so many restrictions where partners couldn't accompany women to ultrasound scans, couldn't accompany women to hospital appointments. So it has had a major impact on the involvement of the other half within the relationship to be there for all of these appointments and issues. And I think one of the ways that we have kind of tried to work around it is to have telehealth appointments, to have FaceTime while we are speaking to the person who is in clinic with us. But COVID has meant that we've had to, be innovative in how we involve the person who can't physically be there in the room. But starting from there and then building from there and having every conversation that actually isn't just about one or the other, it's always about the two people involved in that situation. And that, I think, is the place to start from and always continue down.
Sam, any final thoughts on your end?
A lot of that. I think we also, health services probably need to be aware of their own biases, right? Sometimes it is that whole, okay, this is a female problem, so I'm going to talk to the woman about it because it's reproductive producing a baby. Particularly when you see more general health specialists, like maybe a GP, because this is not the only topic. They might have like however many patients a day and then jumping from one thing to another. See it less so when you see a fertility specialist because they're trained specifically how to deal with this. But it talks to the point earlier of there's no clinical guidelines on how we manage this, right? So if we have those, maybe then we can make some awareness that this is like the partner needs to be involved too. But yeah, no, I echo everything that Nisha said there as well. Let's bring both into the conversation. But yeah, we also have seen the other side of the lack of partners in scans has been heartbreaking for our community, and the trauma that will last from that is still being felt now and will ripple on for a long time.
I want to thank you both so much for sharing your time and wisdom today, and really kind of lending your support to a program like this as well. The work you both do is so vital in the community. So thank you again. I'm going to now bring in Angela Priestley, who is going to moderate our next session around what parents need. So following on from this one. Thank you so much.
Thank you.